Well, happy Friday, folks. It's that time of that part of the week again where we get to get a little bit of education on all things health. Today we are excited to have Shyrea Thompson. She's a member of our NMQF Advisory Board, and she's in, as we discussed earlier, she's in the inaugural class of our 40 under 40. Back in 2016, she received that honor, and now we're in 2021, and my math is bad, so we're in the sixth counting class of 40 under 40. So we're excited about the next 2 weeks welcoming the new class of winners. One of our speakers today is in last year's class, Mr. Johnson, and then Michael Crawford, who's speaking, is on our advisory board. And so we have all this great knowledge, and they're ready to share with you. So without further ado, I'll turn it over to Shyrea Thompson.
Oh, thank you, Brandon. And I'm honored to be here with each of you. And also thank you to the National Minority Quality Forum and Dr. Puckrin as well for his leadership. It's exciting to be here today because we know there's been so many developments in the COVID-19 space. And as we find purpose in the pandemic, we know that we have to continue to reach the most vulnerable communities. So today we're going to hear from these experts. They're both hospital administration leaders, and Michael Crawford and Rashard Johnson are going to talk to you more about their efforts to distribute the vaccine at America's hospitals. So we're going to hear a little bit more about the work that they've done to get the vaccine to community leaders, what they've learned during the pandemic, and then also their plans for the future. We're going to start off by hearing a little bit more from Michael, who is the Associate Dean for Strategy, Outreach, and Innovation at Howard University's College of Medicine. He has an illustrious history of leadership. One of them is actually here in DC, where I also live in the area, with Unity Healthcare as the Chief of Staff of a federally qualified health center. Not just anyone, but one of the absolute largest, and Unity has done some incredible work in this space. So we're excited to hear from someone who's done this in different ways and also has experience with Johnson & Johnson. And we know many of you have sent in questions about Johnson & Johnson. In addition, we're going to then hear from Rashard, who is the president of Advocate South Suburban and Advocate Trinity Hospitals. And as Brandon shared, he is a fellow NMQF 40 under 40. And what warmed my heart, I'm also a preemie mom, and so we both are preemie parents as well. So it's always exciting to see when people are living their values and walking in the shoes of the patients that we aim to serve. So thank you again, and we're going to get started. I'm going to hand it over to Michael to tell you a little bit more about his work to make sure that we can get the vaccine to the most vulnerable populations. Michael?
Well, good afternoon, everyone. Thank you, Shyrea, for that kind introduction. Really appreciate it. Wanted to thank Brandon, Garrett, Dr. Puckerman, and National Minority Quality Forum for the opportunity to discuss this stimulating topic and to be here with Rashard Johnson. I think that we hope that we'll provide some great insights for you and talk about some relevant experiences in our individual markets. This COVID-19 pandemic obviously has been one of the most disruptive pandemics that we've seen in quite some time. It has completely upended how we function in our daily activities. And Howard University has been in the COVID fight like many healthcare providers since last year. And when we heard the news in January of last year that our world was being turned upside down, we had to quickly pivot to make sure that we were implementing processes and protocols to ensure that our staff, our patients, as well as in our case, our campus was safe. So we quickly looked at opportunities to establish testing protocols, policies, make sure that we establish a remote working environment for those staff that did not need to be in the facility at the time. And then also for those essential staff that they had the PPE required to be able to function within an inpatient and outpatient environment. That led to us quickly establishing COVID-19 testing sites within the community. What we recognize that a lot of communities and folks that reside in medically underserved communities did not have automobiles to participate in drive-up testing sites. So we essentially had to meet people where they were at. We had a couple outpatient facilities in medically underserved communities, so we quickly repurposed those settings and turned them into testing sites that were accessible and walkable for individuals to be able to be tested in their communities. That quickly led to a partnership partnership with a faith-based organization where we extended our ability to test. And when we were testing, we were one of the only free testing sites in the country at the time, and then other folks quickly came on board. From there, we transitioned to trying to stand up a Clery certified lab within our environment to make sure that we could turn around tests in a fairly efficient and rapid period of time. At one point, Quest and LabCorp were running 7 to 10 days in terms of receiving results. So through a partnership with Thermo Fisher and the JUST Project, we established a Clery certified lab to best support our employees, staff, and our students to make sure that we were creating a safe environment for them to be able to work effectively. And then we extended that work in establishing a COVID-19 vaccine site, which occurred this past January when we administered our first vaccine. And to date, we have been operating that vaccine clinic Monday through Friday from 8:30 to 2:30 p.m. And we have vaccinated up to approximately 20,000 individuals at this point. So our throughput has increased over time. And as of March 29th, we've been vaccinating approximately 700 to 800 individuals and have been participating in a number of community and strategy-oriented activities that I'll talk a little bit more about during the course of this session.
Excellent, Michael. Thank you so much. I heard three things: free, meeting people where they are, and timely and safe. And I think if you're listening, we know that those are some of the best practices in any public health intervention. But certainly it's exciting to hear that you were leading in those areas here in DC, but also, as you said, encouraging others across the nation. So Rashard, I'd love to hear how you are working with the rollout in Illinois.
Yeah, absolutely. And just so encouraged by all the great work. So congratulations and thank you. I share it with Michael, my respect for the work that he and his team are doing, and just all of our heroes, even those that are on this webinar. I thought he hit on some poignant points, and for the sake of not being repetitive, I will kind of touch on some of the things that we're doing here on the south side of Chicago and also in the south suburbs. But as a system, Advocate Aurora Health, we have about 28 facilities throughout Illinois and Wisconsin. And so our operation ranges through 75,000 team members, 20,000 physicians, and over 500 sites of care. And so lots of lessons learned. And going through this pandemic, I agree with Michael wholeheartedly. This was unlike anything that we've seen before. And quite frankly, it's an experience that I will never forget in my life. Just the sacrifices that our heroes have made, facing danger in a situation where you don't have all the answers. As Michael mentioned, things were changing rapidly, and you were scrambling for PPE and scrambling to get an understanding of how this whole virus transmits and what the impact or long-term impact, and to see our nurses and our physicians, our EVS team members, our nutrition workers, all those frontline support services and direct care personnel brave this whole storm. And on the south side of Chicago, we got hit extremely hard out of the gate. For the better part of 13 weeks, between two of my both of my sites of care that I'm blessed to oversee, we had about 95% occupancy related to COVID. And collectively, that's over 435 beds. And so you start doing the math. For 13 weeks to endure that type of surge, and then to watch the havoc that is wreaked on communities of color, in particular, our Black community. Very gut-wrenching, very inspirational to see our doctors and our nurses brave that, but also inspiring. And I think it touches on why we're here today to talk around the need for this vaccination, in particular with our community, because when you look at the mortality rates, those data points that showed our mortality rates being precipitously higher than others, those aren't data points to me. Those are reality. They're probably the darkest moment of this entire pandemic. I remember just behind me in our executive boardroom and our incident command, I remember ordering refrigerated 18-wheelers because the morgue overflowed and the funeral homes couldn't keep up. And when you pause and think about that for a moment, lots of sleepless nights was behind that, seeing that type of mortality. And so the virus is extremely real. And so I'm excited to see where we're progressing and where we're going now. We've stood up clinics, vaccine clinics in both of our sites. To date, across our entire system, we've administered well over 400 and almost 490,000 vaccine shots. And so that's a big deal. We've done 15,000 or so at one hospital and over 12 at the other. And reaching out to the community, reaching out to team members, and just getting the word out. And then I think from us, from a leadership standpoint, also walking the talk is extremely important. Because I've had a number of my team members are like, okay, and they never call me, I don't allow people to call me Mr. President. They call me Rashard, but when they want to be sarcastic and make a point, they're like, okay, Mr. President, are you taking the shot, you know? And so I definitely lined up to take the shot and to promote it along with my team members to walk the talk. So I'm excited to be here. So thank you to the National Minority Equality Forum. Such a pleasure. Excited, Shyrea, to share this moment, and let's take care of our people.
Yes, that was excellent. Let's take care of our people indeed. And for you, obviously, in hospital administration, your people are the community, your people are your staff. I loved how you highlighted our heroes that have been on the front lines, but also what it's meant, right, to see not only our patients, but our loved ones pass away. And those are some really hard decisions. So Michael, I know you touched a little bit on this at first, but I wanted to just see if you had any other highlights that you wanted to share on the efforts that you've made to increase vaccine access, especially in areas with low vaccine rates.
Yeah, I think one of the things that has been amplified during this pandemic is traditional and non-traditional partnerships. So we've started to engage in a lot of different partnerships to reach the community, to work with thought leaders and influencers in communities where we know their voice is well received and respected. So we have had several, most recently we've engaged in several community-oriented partnerships, and I'll talk about three. The first partnership, we've partnered with a council member in Ward 6. So Washington, D.C. is divided into 8 different wards. In Ward 6 crosses over into an area called Northeast Washington, D.C. Northeast area of Hill East, not far from the old RFK Stadium, has been traditionally an underserved area. And at the time of this event was one of the lowest vaccine rates in the District of Columbia. So we partnered with Councilmember Allen and his staff to establish a vaccine clinic at Mount Moriah Baptist Church, working with Pastor Lucius Dalton to establish a vaccine clinic. We worked with the councilman and his staff and community-based organizations to do some door knocking, literally hit the ground, knock on doors, and get people out to the vaccine clinic. Council members, staff, and the community-based organizations organize transportation because we know transportation is a social determinant of health and also is a barrier for folks to receive care, receive testing, and also to receive their vaccine. So we work with the council member and their staff and community-based organizations to get the word out. And we established that clinic, and we were able to vaccinate up to 180 people in that area on one day. In that neighborhood, 180 people is a significant amount of people given that geography and that zip code. Then we partnered with Miss Coral Masters Berry, who is the former wife of the late Marion Berry, the mayor of life in the District of Columbia, to conduct a mass vaccination clinic with 2 other hospital partners, MedStar and George Washington, and a number of community-based organizations to vaccinate 1,000 residents in Ward 8. The initiative was unique to Ward 8, and we were only vaccinating individuals that resided in Ward 8. So we came together, we developed a outreach and education strategy, did a lot of door knocking again. And it was really more of a get out the vote type of campaign. And I think that you have to have that enthusiasm in organization to get people to these vaccine sites. And for that event, we were able to vaccinate 859 individuals and even register individuals on the spot. The last event was more of a national event that we participated in, which was with the Washington Cathedral, where it was a public vaccination event of faith-based leaders. The NIH, the CDC, and the White House Office of Faith and Neighborhood Partnerships participated in that event, and clergy leaders were vaccinated on camera. And we also recruited patients to come to the National Cathedral to be vaccinated on site. Pictures were taken, selfies were taken, so we leveraged social media and the word of mouth to get people out to these events. So we really have been looking at different partnerships to embed ourselves in the community and use these community champions and influencers to have people come out and be vaccinated. And those initiatives have been successful. And I think we are continuing to do that with other community-based partners.
Excellent. I mean, such multifaceted approaches. One of the things you mentioned was social determinants of health. And in my work, I work often with another vulnerable population, which is cancer patients. And oftentimes the biggest barrier, regardless of the barrier or issue or disease, is really transportation. So it's excellent to hear that you're tackling that. But Rashard, in your role, obviously, you're working with social determinants of health as well. And they play a big factor, we know, in COVID-19 and also its impact on communities of color. One of the hospitals you lead is predominantly African-American and in a predominantly African-American community. Can you share a few thoughts on how racial, health, economic, educational, and environmental factors may increase the risk for COVID-19 in communities of color? And then also, why is it important for the African-American community to get vaccinated?
Yeah, great question. And when you look at social determinants of health, those of us in the healthcare space, we know the impact that it has, and especially those of us African-American brothers and sisters that have been blessed to move up and escape sort of poverty-stricken areas, and then you have an opportunity to deliver care, you realize the gaps and the disparities and the systemic racism in medicine that really exists today. So when you think about COVID-19, COVID-19 has really put a spotlight on what we've known all along. And it put a microscope down on communities of color that have been disenfranchised, lack of investment, lack of resources, lack of access, food deserts. And so what it does is, coupled with, you take COVID-19, you couple with some of those disparities that we suffer from: COPD, CHF, hypertension, diabetes. The mortality rate shoots through the roof. It shoots through the roof. And so social determinants of health are extremely important from a healthcare standpoint. I heard one of my doctors gave me some statistics that said it's about 80% of your ability to deliver quality care is the social determinants of health, and the medicine is the 20%. So what are we looking at? We're talking around quality paying jobs, affordable housing, ability to eat not just fast food, but really great food that's there, education, all of these other, transportation. Michael mentioned, Shyrea, you mentioned it as well. Transportation, my ability to get to and from doctor's appointments, et cetera, where I can be proactive as opposed to reactive and episodic care that happens in the ED, which is extremely costly compared to what it is to go to a primary care physician. Not to mention, by that time, we're already at stage 3, most of the people that we see. And now you're talking, how do we prevent you from death, as opposed to how do we take care of you in the forefront. And COVID just put a spotlight on all of that for the entire world to see. And so as we've been having these conversations, it's it's almost a silver lining in the cloud, if you will, because it's like now you realize this is real. All of the lack of investment, et cetera, et cetera. And so in terms of social determinants of health, it's everything. Now, the second part of the question, which is why is it important for us to embrace the vaccine? For everything that I just said in the beginning, which is, I know, and I'll just speak to my family. We have hypertension, we have diabetes, we have CHF, we have CO. I mean, you go down the list of those comorbidities, we're plagued with it. Now, if we contract this virus, how would our body react? Well, statistics says when you have those comorbidities and you get coupled with the virus, the mortality goes up. So the chances of it being an adverse impact on you are much greater. So to that end, as communities of color, the conversation that we've been having with our local faith-based leaders, because there's a trust thing, right? And so you might not trust me as the hospital administrator, but you're gonna trust Pastor Moss over here running Trinity UCC, right? And so I partner with Pastor Moss to go in there to ensure that we know and we're knowledgeable that we can't gamble with this thing. We have to embrace this vaccination to give us a chance at quality life and give us a chance to thrive and build generations like everyone else.
Yes, no, I love that you shared about trusted voices. I've been grateful to work with Henrietta Lacks' family in this space as they reclaim her story and make sure that the community is not lending some of that emphasis on hesitancy, but instead talking about the historical injustices, medical racism, the inequities that have led to the hesitancy, but really, right, building that confidence with trusted voices and partnerships. And not always blaming and placing the blame on patients or community, but instead making sure that we're really looking at the systemic issues. And I love that you're doing that with trusted partners as well. So Michael, in your role, you highlighted some partnerships as well. Can you share a little bit more about how your partnerships at Howard or in DC have played a role in the COVID vaccine and education efforts that you've led?
One of the areas where we have been focused on as well from an academic institution is that we participated in the Novavax phase 3 clinical trials. So we quickly built on some of our community engagement work that we have been doing prior to COVID and stood up a community advisory board. And that community advisory board was comprised of different community leaders and thought leaders in the faith community, in the housing community, the Latinx, the Black and African American community. It was just composed of a broad representation of the district, Maryland and Virginia. So that committee gave us a lot of insights about what folks were thinking at a community level in terms of how they view clinical research, how they view COVID, how they looked at receiving a vaccine and why they were hesitant. I think Rashard did a great job of highlighting the role that social determinants of health have played, structural injustices and racism within healthcare. I think the numbers do not lie. We know that Black and brown people are disproportionately impacted negatively by the healthcare system. The data, there is copious amounts of data to support that. So that contributes to this notion of how should I approach clinical research and what has happened with clinical research in the past. And then folks have received and have taken medication. How has that impacted me? And am I represented in the clinical trials that are supporting the data of new vaccines and medications on the market? So we've leveraged those relationships with these community leaders to ensure that we were understanding how we should be communicating the message to folks within the community. Sometimes we weren't the appropriate messenger for the message. So as Rashard mentioned, we partner with a pastor, and for our situation, it was Pastor Curry or Pastor Dalton or other pastors delivering that message to their constituents and residents. It was a housing leader that focused on low-income housing that was able to message to their community and their constituents. We also had DC Housing Authority, who was responsible for the largest portfolio of low-income and public housing in the District of Columbia. They partnered with us to make sure that we were getting the message out to their constituents as well as their residents within the Housing Authority, just to make sure that we were priming the pump, if you will, in addressing those questions proactively. So when it came to the moment of truth to receive your vaccine, all of your questions were answered to the best of our ability with the most available information. And what we found is that when that happened, it boosted confidence in receiving the vaccine. Because you hear this narrative about vaccine hesitancy within the Black and the Brown community. And what we believe, it is a gap in information. And there's some historical factors that are influencing how people view the totality of healthcare. So how can we arm them with the appropriate information to make sure that folks are making informed decisions about their choices? So we've done that obviously through webinars, through Ask the Doctor sessions, through community-oriented events, virtual and in person. And then also we work with some of our payer partners that have access to all of their members and work with them to create a schedule for them to schedule their members into our scheduling templates so that they can be vaccinated at our clinic. And those types of partnerships have worked out phenomenally well because our payer partners not only have access to contacting you with all the appropriate information, but they also have resources to provide transportation, other wraparound services that need to be administered, i.e. housing, i.e. food types of things, and then also medical care that extends beyond COVID. So those are some of the things that we've been working on the ground and have been effective, and we will continue to build upon some of these relationships and infrastructure that we have established during the pandemic.
Excellent. You touched on a couple of things that are so important. We know that the pandemic has affected every part of our lives. Screening rates are down for all types of diseases. And I love that you're working with payers to make sure you're getting patients, not just about COVID, but again, looking at the total aspect of their health. And then you also shared really what the crux of what I always say, right, Black and Brown communities are not monolithic. And so if you're only coming to churches, you're missing some of us. So the fact that you're reaching people where they live, work, play, and pray is definitely a model that speaks to what we need to be doing to reach all these communities. And then you also covered the infodemic. And I think that takes us to one of the questions for Rashard, because often there's been, a lot of concerns about some of the concerns around allergic reactions to the vaccine, myths, and making sure that people get accurate information, right? As you pointed out, is much of the battle, and making sure that we're not perpetuating facts that are not true in our own communities, and making sure we're getting credible information to our community. So Rashard, what measures have your hospital taken to make sure that you can respond to the 1 in 100,000 who may have issues with the vaccine, and make sure that you can address some of those real concerns?
Yeah, the first part is for us to be honest, right? Honesty is the best policy, that there are some reactions that happen. And so what we've done is I've personally gone around, and my executive team goes around, and we have our iPhones, our Androids, whatever. I use my iPhone, and I videotape myself and our frontline team members, whether it's a nutrition services worker or a nurse or a physician, someone that's out there, and we talk around the vaccine, the fact that you've taken the vaccine and what reactions you've had, if any. And it's always great. It's very engaging, as you can imagine. They have a lot of fun with it. They always give me a hard time during it. And I share my story. I mean, when I took it, I didn't get any, I took the Pfizer vaccine. I didn't have any reaction. First shot, just soreness in my arm. Second shot, soreness in my arm, et cetera. But within my executive team, as we had conversations, there were several of us who did have reactions. Some had chills, some had slight fever, some was lethargic, very tired within the first 24 hours, and then that sort of went away. And I think it's important for us to share that, that's your body reacting, that's your immune system reacting, which is it's not a bad thing, first and foremost. So one of the things that we do at our clinics is we ensure that we have a 15-minute sort of grace period where you're monitored and after you've taken the vaccine, so we can look and make sure that you don't have any anaphylactic shock, et cetera, whereas we would need to do a cold team and take care of you in the ED. So blessing for us, and I rambled off the numbers that we've had. We haven't had to have any of those cold teams sort of called, but our chief nursing officers at both the sites, they lead this effort for us, and they ensure that our nurses are ready, our therapists are ready, our doctors are ready in the event. And that 15-minute grace period where they're monitoring is real, because I remember when I got my shot and all of our team members are there, and it was done like on a Saturday. And so I sort of came in, I had my Walter Payton jersey on and my Chicago Bears Scully. And so you can't really tell it was me. And we got the shot, and I wanted to take pictures with our team members, and just before they left, because I wanted to, really capture the moment, like Michael said, and put it on social media and sort of leverage that, all the great things that they're doing. And our nurses would not let me leave that 15-minute grace period. They were like, no way, I don't care what your position is. You're gonna sit right here and I'm gonna monitor you for that 15-minute period. So those are just examples of what we're doing to ensure that their safety that's there. And again, with all the thousands and thousands of vaccinations that we've administered, we haven't had to call rapid response or anything, but we do have those measures in place.
Excellent. I love it. Using digital and real stories, right, from trusted voices to make sure we can combat those fears and get the message out. So we're going to open up to Q&A. So if you are joining us, we know that you can actually share your questions with us for Rashard and Michael in the Q&A box. And then also some of you provided questions before in registration. So we're going to open up with a couple of the registrant questions while you share your questions in the Q&A box. So the first one is, can you discuss getting the vaccine to the most vulnerable people, such as seniors and people that are in nursing homes and others with underlying conditions? And we also want to add in as well, pregnant women. We know Maternal Health Week has been a focus, and making sure that we are including all of the vulnerable populations.
So I'll take that question. And one thing that we have been doing, and I think this is in most states have eligibility criteria and phases that they move through. In this past week, on April 12th, DC moved to 16 and up. Everyone 16 and up in the District of Columbia is now eligible to receive the vaccine. So within our phased vaccine approach, the most vulnerable folks were in the earlier stages of our eligibility criteria, particularly those individuals that were 65 and plus. Then we transitioned to those frontline workers, as well as the folks with underlying healthcare conditions. So when we were in those active phases, we reached out significantly. If there was a senior housing complex, either Howard or other healthcare partners would work with the District Department of Health to set up opportunities where you can vaccinate seniors on site. If you had folks that required different types of language services, you make sure that you had those language capabilities readily available for off-site vaccination initiatives, either establishing a vaccination site within a senior housing building or deploying a mobile unit to the community to vaccinate individuals via the mobile unit. Also working with some of our partners, if they have those types of individuals within their network, individuals with underlying conditions, obviously we work very closely with our payer partners to make sure that we prioritize those individuals. We also work with the district government. They had a prioritization algorithm that looked at prioritizing zip codes that were disproportionately impacted by COVID-19. So those were predominantly Black and brown communities in the early onset of our vaccination efforts. So those folks were being prioritized and sent to vaccination sites. We obviously were doing a lot of outreach in our clinics with our doctors. So they were educating first, then providing opportunities for folks to quickly transition over to our vaccine clinic or be vaccinated within our individual clinics. So we were doing a lot of outreach in those areas, particularly with our subspecialists that are dealing with diabetes and hypertension, COPD, cancer, et cetera. We would actually take a vaccine over to our dialysis centers and vaccinate folks while they were in dialysis, making sure that they received their vaccines. We have a sickle cell disease center. We would take vaccine over to our sickle cell disease center to make sure that we were vaccinating the folks that were the most vulnerable. And I think as medical professionals, and Rashard mentioned this earlier, we are enthusiastically looking to vaccinate those folks because obviously they're the most vulnerable among us and have the largest opportunity of having a severe adverse outcome. And then last point I want to make before we transition to another question is around pregnant women. Through our clinic, we've been vaccinating pregnant women, and all of the data says that is okay to do. But we also say that you need to consult with your physician and for your own individual medical situations to determine if it's appropriate for you to receive a vaccine. At our vaccine clinics, we don't render care, we just administer the vaccine. So if you are a patient, obviously we understand your patient history, but because we partner with the District of Columbia and we're receiving patients through the portal, we always ask folks to consult with their physicians if they have an underlying condition or they are pregnant before they come to the vaccine clinic.
Yeah, Shyrea, I want to piggyback on a few things that Michael mentioned. Just add on to that. One of the things that we've tried to focus on, and just like you're doing in DC, we have those similar metrics and those tiers, et cetera, as it relates to rolling it out. But having the conversations that we've had, it's been like, how do we make it as easy as possible, right? And so if you're dealing with, like for instance, I always use myself or my family. If you're dealing with my family, it's like, if you're gonna make me jump through hoops, then chances are I'm not doing it, right? And so it's to Michael's point, bringing the vaccination to them where they are, meeting them right place, right time, and making that ease of access extremely possible is great. So we've done things through our Live Well app, and so we have an app for those who are technologically savvy, can get on the app and make their appointments. Definitely set up the call center as well to filter calls. We've done things in terms of a campaign that we call a No Dose Left Behind campaign, whereas let's say if Shyrea's scheduled and she meets the tier criteria, she's scheduled to get her vaccine, but all of a sudden she can't make it in. But we have Michael on this list, and even though Michael may not be in the particular tier, but he can get here within an hour to get his vaccine so that we don't waste it. And then that's our No Dose Left Behind, and we've been able to reach a lot of people through those mechanisms and those conduits. So I just think like making it as easy as possible. It sounds simple, but it's so important to do, and bringing it exactly where they are, meeting people where they are.
Excellent. So you both kind of talked about a couple of things that I'm going to raise. So one of the questions we received were regarding the communication channels, right, for raising awareness about the importance of the vaccine for vulnerable populations and communities. So you talked about your campaign. Can you share, either one of you, anything else that you would highlight as best practices for communicating and using communication channels?
Mike, you want to start that off?
Yeah, I'll start. Well, one thing I think it breaks down by demographics, right? So what we recognize with our young folks, they receive a lot of their information via social media, right? So we have to figure out how to communicate with influencers within their spaces where they receive their information. So if that is trying to develop a TikTok video around vaccines with an influencer or a community thought leader that might impact them, is trying to figure out how to leverage those communication channels with that particular demographic. For the older adults, 65 and above, and I think this is well documented, those individuals struggle with accessing appointments via an online registration process. So how do we mobilize a team to get out into the community to make sure people are being signed up? And if they are not being reached by a robust ground game, do we have phone numbers in a call centers, as Rashard mentioned, for them to be able to call, or to have a caregiver or a surrogate call to be able to schedule an appointment? And then the last piece is really around just trying to influence, try to engage the influencers and thought leaders within the community, and to make sure that they have the information they need to be able to message appropriately. And I think to Rashard's point, even with receiving the vaccine, with identifying your thought leaders and influencers, keeping that message as simple as possible, in a way that people understand it, without jargon and medical terms, I think is critically important in terms of communicating that message out to a broader set of individuals.
Excellent. Michael, just wrapped up, but Rashard, do you have anything else that you'd like to highlight? I know you talked about those excellent campaigns that you're already using, but I want to leave.
I just put an exclamation point on that influencers and those key stakeholders in the community. And so for us, the Legislative Black Caucus is a big deal here in Chicago and out throughout Illinois. And so getting on the phone with them and saying, hey, Madam Legislator, Sir Alderman, need your help. Know you're the voice of the people, and your constituents and your network is wide. So I send them a weekly update so they know exactly what we're doing at Advocate Aurora Health, but then the outreach that we have in the community, and so that they can share it with their network and their constituencies. And so that's been it's been great leveraging each other's platform, because we're all here for the same reasons. I mean, they're here to serve. We're blessed to serve and to help people live well. And through that partnership, we can overcome the pandemic together. So I think that's a critical point that Michael mentioned. You have to do that, because each one teach one, and it takes all to sort of lift the boat.
Excellent. So we actually received a question that I'll skip to now because it speaks to what you're referring to. The question is, what would be recommendations for a national and or statewide initiative to reach out to the whole population of those most vulnerable? And basically, how can we get this to scale? I know that both of you are leaders in your state. So I think some of the examples you've already given really do speak to the whole statewide effort. But if you wanted to share more about national and scale.
Yeah, and I think that's where healthcare leaders have to link in together, right? So we have colleagues. I mean, Michael's running hospitals that's over there in DC, and we all have colleagues that's around. I think you take your healthcare leaders and you take your legislative leaders when you're at that state level, and then reach out nationally and look at best practices. I'm a big believer of not reinventing the wheel. I'm always like, who does it the best, and let's just replicate that and just keep it moving. And so I think on a national scale, we go and we find out, the statistics that's behind it. I once heard Jay-Z say, men lie, women lie, numbers don't lie, right? So we find out who got those numbers, and then we figure out how to replicate that and how to build that best practice at the state level. And so I'm a big believer of that. Mike, I don't know what your thoughts are.
No, I agree, and I think that this is a huge opportunity for us to be able to compile best practices, and think about not only how we leverage those best practices in the pandemic, but how do we build upon those best practices post-pandemic. And I think that some of the initiatives that the administration has taken recently, with sending doses directly to federally qualified health centers throughout the country, has leveraged this federally qualified health center network and empower them with the vaccine and resources that they need to be able to vaccinate communities that are traditionally underserved, Black and Brown communities. So that national effort hopefully will bear a lot of fruit in terms of us being able to vaccinate more people at a higher scale. But I think having forums like this, right? Sharing information about what's occurring out in Chicago and Washington, and thinking about how some of the things that we talked about could be implemented within your own state or geography. Sharing comments through the chat forum about what has worked well for you, so we can dialogue about some of those things that they could be modified or enhanced for maximum impact in other geographies. So I think that this is truly a learning opportunity for all of us to think about how we reimagine not only healthcare today, but in the future, particularly for communities that have been under-resourced, underserved. And I always think about this concept of resilient communities, right? How do we fortify these medically underserved communities, build them back better, make them more resilient? So when we have the next pandemic, we don't have to worry wholeheartedly about food insecurity, about transportation, about people not being housed or people being uninformed, people not having access through sufficient broadband. So I think that we start to think about these things, about what has worked well, but what are those opportunities areas where we can really build more resilient communities throughout the country.
Yes, I love that you brought up the sharing in the chat. There's already been some folks that have shared resources, so thank you. Definitely keep them coming, because again, that's actually how we do tackle this, learning from others, looking at those best practices. There's actually been 4 questions submitted for Johnson & Johnson vaccine questions, so I'm gonna actually kind of smash them together. But first off, can you discuss the implications of vaccine hesitancy following the challenges with AstraZeneca and the recent pause on the J&J vaccine, Johnson & Johnson, due to blood clots? And then the other question that we also received is asking you, what questions are you hearing about the Johnson & Johnson vaccine? And if it's removed from the market, how do you think it would impact our ability to reach the most vulnerable? So a bit about how it's impacting us. What are you hearing, and how might it impact our ability to reach the most vulnerable? I don't know if Michael, you want to start, because I know you've worked actually at Johnson & Johnson.
Yeah, let Michael start. I don't want any of that smoke, so we're gonna let.
So in fact, I'll start with, we operate a vaccine clinic Monday through Friday. So when the J&J news broke, it broke on the day that we were hosting a Johnson & Johnson vaccine clinic. So we quickly had to pivot to alternative strategies. So we were working with our local hospital association, our local district of health government to determine how we would pivot and to accommodate folks that still wanted to receive their vaccines. Obviously, folks that were hesitant to receive the vaccine probably are more hesitant to receive the vaccine based on what has been occurring with AstraZeneca and Johnson & Johnson. My understanding, reading the most recent data last week, Johnson & Johnson, there has been over 7 million doses administered, and a finite amount of individuals that have had this adverse impact related to the blood clot, which was, in my understanding, was all women. So I think that it has had an impact on certain individuals. Other individuals have quickly said that I do not want to receive J&J until the information has been clarified, until they have addressed that issue from a governmental and regulatory perspective. But meanwhile, I still want to be vaccinated. And if I can be vaccinated with Moderna or Pfizer, I will choose to be vaccinated by Moderna and Pfizer. And so what we have done is we've pivoted and transitioned those Johnson & Johnson appointments either to Moderna or Pfizer to ensure that the folks that want to be vaccinated have an option of being vaccinated. And I think that's one of the benefits of administering the vaccine within a hospital system, is that you have the ability to pivot to different vaccines. Whereas if you have a community-oriented site that is only administering one vaccine, that means that there will be either hundreds or thousands of appointments canceled because folks do not have an alternative. So what we are doing, like everyone else, is waiting for more information about J&J to determine how the experts and regulators are thinking about next steps related to the product. Meanwhile, we are continuing to vaccinate folks with the product that we have available, which is Pfizer and Moderna.
Yeah, same here along those same lines. When we look at just from the data standpoint, Michael, I think you're spot on with that six cases and the millions that were administered. For us, we still err on the vaccine is our way out, honestly. And I've had literally before I was able to get on this webinar, I had a close friend of mine called and he's like, "Hey, what should I do?" You know, they were trying to give me the J&J and he was worried. He was concerned that about the other vaccines based off of what he's hearing and the rhetoric, what he's reading. And so I really had to walk him through that and take him through what my primary care, my PCP, one of my doctors, Dr. Tony Hampton, he's my PCP, the intimate conversation that we had, which was, this isn't about me being an administrator here and the leader. This isn't about us being working colleagues. This is about, you are my primary care doc, and I want your opinion on this vaccine as it relates to my health, right? And quite frankly, he said, "Hey, I'm scared of the virus," and I was like, "Whoa!" It caught me. He was like, "I'm scared because you don't know how your body will react." And then he gave me some examples of, just his patient panels, and some people who were in their 40s and contracted it and passed away with no underlying, and some people who lost sense of taste, sense of smell, and are still dealing with that, 10 months down the line. And he was like, it's just a big gamble. And his thing was, I like my chances with the vaccine versus my chances with the virus and not knowing how my body is going to react. So I think it's extremely important that we pivot and that we embrace Pfizer or Moderna, both of which have an efficacy that is greater than that of the flu vaccine that we take, by the way. So, and I learned that through my physician as well.
Excellent. So one of the other questions, now that we're talking about industry and industry's role, was what do you perceive the role of biopharma in facilitating equitable access and the uptake of the COVID-19 vaccine?
You want me to?
Yeah, I'm sorry. I was trying to get off mute. I was having some issues with my PC. I think I'll start this one off. I think so. Biopharma, I think they play a big role. We got to step it up and we got to really walk the talk. Right? And a lot of people have come out over the last year, especially with the George Floyd and really the twindemic that we were dealing with, because we were dealing with the social inequities and injustices, et cetera. That horrific situation as well as a pandemic. And people came out, and you had all these corporations that step up and say, we denounce racism, we stand for equality, we're gonna invest in communities that have been disenfranchised and underserved, et cetera, et cetera. Well, I think now is the time for the rubber to meet the road. And when you look at biopharma, clinical trials, things of that nature, investments and grants and things, I think they play a huge role into communities of color and how we embrace medicine moving forward and just the economic engine that they can provide. And so I think it's time for us to call on them and bring them to the carpet and have them take a more hands-on approach in our underserved communities, because it hasn't been that way in the past, at least in my opinion.
And what I will add to that, because I think those are excellent comments, is that we have to move beyond this narrative of it's a good thing to do, right? To it's the right thing to do, and it makes best business sense for biopharma to do this, right? Because it's in the collective best interest of healthcare to have biopharma actively engage in communities of color, looking at how they diversify their workforce that reflects the broader population. So if you're doing clinical research, there should be someone of color within that clinical research team. If you're working with a clinical research organization, there should be some representation on that within that community resource organization, that clinical research organization. If we're thinking about branding and marketing and how we structure the rollout of products, you should have a diversified workforce that offers different perspectives and opinions in terms of what that should look like for the broader population. In terms of investments, I think that there could be broader investments in the healthcare system, right? In healthcare infrastructure. There's been a big bill being talked about right now at the national level about infrastructure. And I think a big part of our response to COVID, especially in medically underserved communities of color, will center around infrastructure. I think biopharma could play a huge role in ensuring that the infrastructure is in place to administer COVID-19 tests, to disseminate vaccines, to make sure that we do not have pharmacy deserts like we have here east of the river in Washington, D.C. I'm sure in the south side of Chicago or Philadelphia or New York or California or Houston. So making sure that people have resources available to live a healthy and productive lifestyle could be a huge effort, I think, for biopharma to make sure that all communities have a fair opportunity to live a healthy and productive lifestyle.
Excellent. So there's another question, and this one is actually more focused on recommendations for people who have had COVID. When are they eligible for the vaccine, and is there a time factor for delaying taking the vaccine? Not sure if Michael or Rashard would like to take that.
Yeah, what we've been recommending, and now I'm not the expert, but I work with the experts, so so I'm gonna preface that. But what we've recommended to our team members and our heroes that have contracted the virus, and we've recommended that you do get the vaccine, but there's a 90-day period that we ask for from the time you've recovered from it to where you take it. Now that's our standard. That's there. Now, we do recommend that you still take the virus. I mean, you know, there are multiple strains that are there, you know, and you go down the list. I think it's like 3 or 4 last time I checked, right? And so taking this vaccine just fortifies your immune system and gives you that opportunity to fight whichever strain that really comes your way. And so we're pushing that. We've had a number of our team members that say, okay, I want to take it, but I'm still within my window. I've had a couple of my executive team members that have come down with it and have gone through that 90-day window and then have taken the vaccine shot.
Excellent. So we'll actually leave time for just some closing reflections. And one of the questions in the chat, I'm going to make it a little broader because I know you're in Illinois and Michael is here in DC, but you might have recommendations for anyone in their own community. What recommendations or how can organizations get in contact with you to support your work to help advance providing vaccines to vulnerable populations? So Michael, if you want to go first, and then Rashard, just if people are listening, how can they actually work with you or partner to get the vaccine out?
It takes a village, right? So this is not an effort that can be done by one organization. It takes a collective effort of all different types of stakeholders and influencers to make sure that people have the right information, one, and then when they have the right information and they're prepared to receive the vaccine, that we have the staff available to be able to do it. Folks can reach out to me via LinkedIn. If there's any opportunities or via email, I think my contact information is available to figure out how we can partner. If it's your communication and marketing firm and you have some expertise there, that's an area where we can tap into. If you're connected to biopharma, you have resources available to invest in different types of vaccine initiatives and efforts, that might be an opportunity. If you are a hospital provider and you have a best practice or a tool that could be leveraged in the market, please feel free to reach out to me. I'm sure Rashard is going to say the exact same thing, but we are open to collaboration and collaborating with people that have the same passion and enthusiasm about making sure everyone has access to life-saving vaccines.
Yeah, I agree. I agree wholeheartedly. And for me, it's the same thing. LinkedIn for sure. I've just started Instagram and Twitter, and so it's at Trill Rashard J. And you know, my 13-year-old daughter analyzes every post that I make, and she's like, "Dad, you gotta do this better, or you can't say it." So forgive me on that, but I'm working through those things. But there have been a number of what I've realized from that, the benefits from it. I've had a number of our either patients or family members of patients that have reached out and said, hey, I'm having this trouble, or I'm trying to get this access, or this is working well. And it's really enabled us to engage on another level. So I look forward to partnering. I believe iron sharpens iron. And I mentioned it earlier, a big believer of best practices that are out there, because we all have the same goal of raising, you know, our communities and helping people live well at the end of the day. So looking forward to partnering together and figuring out what we can do.
Well, thank you both so much. I know we ran over a bit, but we want to thank everyone who shared resources in the chat. We'll work with NMQF to get those out to you via email, and they have a host of resources as well. I see Brandon has come on, so I want to hand it over to him to wrap up as we work together to the most vulnerable.
All right. Well, thanks, guys. As usual, this is a very informative panel, and I really appreciate what you've done. As I said, the gentlemen, you can try to put their info in there, their LinkedIn profiles, but you can Google it and find it yourself and ask them as well. Look forward to seeing. One thing is we won't be having this discussion next Friday because we'll be preparing for our summit, which will start the following Monday. And so we look forward to seeing you Monday at our 19th National Annual Summit on Health Disparities, which we're calling Racism Makes Me Sick. Once again, thanks so much to Shyrea, thanks so much to Rashard, thanks so much to Mike. We really appreciate you, and look forward to seeing everyone soon. And if we do all we're supposed to do, we'll all see each other in person soon too. So thanks so much.
Appreciate it.
Thank you.
Bye, thank you.
All right.